are giving building blocks to someone to help solve a problem. Your body makes these building blocks endogenously. Okay, so regardless of if you are bringing in these building block constituents to help improve your cartilage synthesis, your body will still be doing this if there is damage to the cartilage. So I guess the question that is always there, and certainly stands to reason, but we don't always have a definitive answer, is if we have 10 people who are bricklayers building a building, and I'm bringing truckloads of bricks and mortar to these bricklayers, is the building going to be built quicker or better? Now, I'm not sure if it will, but certainly the building will not be built better if we are lacking mortar, or if we're lacking bricks, or we're lacking some of the other tools that are required to make a building. But also flooding the work site with extra mortar and extra bricks, again, if you saturate your body with these supplements, you're unlikely to be doing any damage, but your body may only be able to repair at its own rate, right? So we're providing, if you provide the body with extra building blocks, it still requires the workers in order to put those building blocks to use. And so there is a time-dependent variable, which is your body's ability to synthesize these building blocks into the final product. And that is certainly dependent on your body. You can't speed that up, so to speak, by providing extra bricks, extra mortar. But certainly you can prevent the problem of not having enough bricks or not having enough mortar, and keep that supply chain there for your body in order to make the building. Again, this is an analogy, but it certainly stands to reason that is the process that's happening not only with the synthesis of cartilage, but throughout your body for a lot of metabolic processes. With any supplement, you are adding things to your body that your body may already have. I eat a well-rounded diet with fruits, vegetables, proteins, and that diet has a lot of building blocks in it to begin with. And my body will take those and assemble them and convert them as necessary. And if I'm not lacking any of those ingredients, then if I take extra through my body in terms of a supplement, then essentially my body is going to acknowledge that it's there and then allow it to either pass through my system or persist within the system but not be used. Right? So people may experience differential results because they may already have these building blocks, or they may already have maxed out that capacity. Your joints do not heal overnight. They don't heal in a week. They don't even heal within a month. It takes a significant amount of time in order to create new cartilage. Cartilage tends to be built slightly quicker than bone, but we know that many people can think back to when they broke their bone, and still 6 weeks later, 8 weeks later, the bone isn't fully healed. So it does take time for the body to do these processes. Giving it the proper environment, nourishment, and building blocks is certainly helpful. Reducing inflammation and swelling that is detrimental to the building process is helpful, and physical therapy and strengthening muscles around that joint to help support it, and reducing the repetitive re-injury process is also important. So I think you have to look at it from multiple directions. Supplementing with the building blocks for cartilage is one of those components that is helpful, but only using all of those together is going to give you some level of complete healing. Sticking with that analogy, if you have the raw materials, the bricks and the mortar, and you have plenty of that, and you have workers who are not rebuilding that building that collapsed, or the cartilage that is damaged, usually, if that's happening, if your body is not repairing itself, it's because of something. That something could either be you are re-injuring that area. You are continuing to be active, to work out, to do whatever you did that injured it in the first place. That certainly doesn't help, right? If a building fell from a tornado and you're trying to rebuild the building during a tornado, it's not going to go that well. Number two, you could still be having inflammation, and inflammation can be cyclical. So even if you aren't re-injuring it, there can be inflammation within that joint space that is retarding your body's process of healing. Inflammation leads to degradation of cartilage, and your body is trying to protect itself, but sometimes inflammation can be counterproductive. So another reason would be too much inflammation. So that goal would then be to reduce the inflammation through anti-inflammatory medications and supplements that could help reduce inflammation.